Jenica provide inventory management solutions into the NHS. We currently have over 12 customers in the UK. Jenica is made up of ex-clinicians, accountants and IT professionals. This enables us to understand the challenges that the NHS face with inventory management.
So when this was suggested that we were to be a pilot study for Jenica, it did come to me as quite a shock when they mentioned a scanning stock inventory system, because scanning to me is something that you would see in a supermarket, and scanning in the NHS really did feel quite alien. However, having spoken to the company and being assured of all the benefits that would come with this, I was very persistent and very supportive with trying to get the process in place.
My husband has been in logistics and stock control for the whole of our married life, and when I used to be a ward sister, he used to laugh at how we controlled stock in the NHS. And so when Jenica came in and we had this project, I jumped at the chance to be the project lead, because I think it's really important to get stock control right in the NHS, and this was an opportunity.
The system we used before was a paper-based system on an Excel spreadsheet. It was not automated, and it was a paper-based, laborious process, which took me probably 3 or 4 hours a week, whereas now it takes me probably half an hour to an hour a week, if that.
It did strike me as being very odd that the NHS, with all the goods and services it moves around and the drive to cut costs, did not use a proper inventory management system.
Some of the challenges that we had to overcome was changing the staff's thought process. We had to get used to scanning individual items, and one of the hardest things for us in the department was when we had different staff coming in from other areas of the trust. They weren't familiar with the scanning system.
This is Jenica's newest device on the market. It's the MCHC. It's aimed at bringing the supermarket experience into the NHS. It's light, simple to use, can read multiple barcode formats, and ultimately will save clinicians a lot of time.
Jenica were the first GS1 accredited partner in the UK, and the offer that we make to other trusts is that we can replicate this success. For example, at Portsmouth, for every £1 that they spent with our solution, they were able to return £8 in savings. The return on investment took less than 3 months. The reason we chose Zebra Technologies is they are the leading provider of scanning technology in the marketplace. Our partnership with Zebra Technology continues to grow as we work on solutions both for today and for tomorrow within the NHS.
We're not just selling technology, we're selling much more than that, and we're actually providing more than that. We're providing change management to actually help people change the way that they approach a process that's much more efficient, and it's actually embedding that technology within that organisation.
The benefits are, particularly in terms of patient safety, and there's nothing more important than hospital and safety, is having the equipment, the right equipment to hand for nurses and doctors who are really busy, and for patients who are very sick. This system saves time. It obviously saves money, which is important in the NHS, but that allows us to spend money in places other than on the equipment. So I think it's a really important system.
Jenica has given us the benefit of a proper inventory management system. First of all, we rolled out a pilot, and that pilot was so successful in saving money and saving stock that we've rolled it across the entire trust now, and the return on investment has been extensive. We expect to get the full benefits within the next 2 years.
Over the last 4 years, Jenica has been able to help organisations to save millions of pounds of cost savings, to improve process in their procurement departments, and directly improve patient care.
Ultimately, it's about procurement linking to outcomes. So actually, have we bought the best product that's going to give the best outcome for that patient? So we are very focused on looking at solutions that start to provide that data for the NHS going forward.
Having used the system for 2 years, we were given the option to go back to our paper-based system, and I categorically said no on all fronts. I'm very happy with the stock inventory system. I've saved time, I've saved money, and I can spend more time with the patients, which is what I'm here to do.